All right.
Hi, I'm Linda Jensen. I'm a resident here in Washington County. Actually, our family has lived in Blair since I was about 13 years old. I went to junior high and high school in Blair, and I'm an RN. I've been a nurse for now 48 years this month, and graduated from Emmanuel School of Nursing in 1970. I'd like to tell you a little bit about what helps young people in their career selection by telling you why I chose to be a nurse. When I first came to Blair, didn't really want to move from the town that we had lived in Ottawa, Iowa. At that age, it's difficult for a teenager to move to a different town. But there was a wonderful school nurse at the Blair school systems. Her name was Jenny Nelson. And she saw me and saw that I was possibly needing a purpose. And possibly she could guide me a little bit. So she had me come into her office. And I worked for her in the nurse's office in the junior high. And in that job, I was able to greet other students as they came in if they were ill or if they needed to go home from school because they didn't feel good. She had me take their temperature and help them to lie down on the bed and just to comfort them, especially if she was out of the office. And then when she came back, she would get a report from me. And I really felt like that was an important job. She also got me involved in Future Nurses of America, which was a club that we had in our high school. So I got together with that group and we would talk about what nurses did, and it encouraged me to look further into it as an option for a career. At that same time, one of my closest friends was Linda McNichols, and her mother was the director of nursing out at the Blair Hospital. And so Helen also had a great deal of impact in helping me to make that decision to be a nurse. I was also working at that time at the grocery store for my dad at Safeway grocery store. And in high school I worked for him, and Safeway really wanted me to go on to be a meat cutter in their group of Safeway chain stores. But my dad didn't want me to do that. He really wanted me to be a nurse. So he had some of his employees approach me and tell me they really didn't think I should be a meat cutter. They thought I should be a nurse. So long story short, I did enter Emmanuel School of Nursing in the fall of 1967. And it was a 3-year program, pretty intense 3-year program called a diploma program, where you went year-round. Every summer you went to school. Ended up being, I think, probably more hours than a 4-year degree program, but we came out with a diploma. The nice thing was that we also had, our education was rich in clinical experiences. We actually worked on the weekends, we worked in the clinical area, we were given an assignment of patients along with another experienced RN. So it was a very valuable education. And when I graduated then from Emmanuel School of Nursing in 1970, then the question became, where do you work? And they told me that if I worked at Emmanuel for 1 year, I would get my whole last year's tuition back, refunded to me. And I remember, of course, things are so different when you're that age, when you're a lot younger, but I remember it was a tough decision. I came to my dad and I asked him, what should I do? They will pay my last year's tuition if I stay for 1 year. 1 year seemed like a long time. And he said, oh, what do you have to lose? He said, just go for it. He said, if you leave before 1 year, everything will be okay. And I have to laugh because I've been with Emmanuel Hospital now for 48 years, and could have, it's just gotten my tuition back several times over. But I stayed there because it has been a very rich experience, very good experience, and they have allowed me to grow in the directions that I felt were good for me. I've been in I help to manage a medical surgical area, a staff nurse on medical surgical, emergency nurse, staff nurse, manager of the emergency department. But I think probably my greatest love for my work has been my work that I've done with the Emergency Medical Services Group, and that's working with the pre-hospital caregivers, the EMTs and the paramedics who are in the community. I feel a very strong bond with them. I've helped them with continuing education. I've helped them with quality assurance. And they are truly some of the most wonderful servants in our community. They truly go above and beyond, and they volunteer their time. An incredible amount of dedication and time that they give up and give from their family time. I think when I think back about some of the things that have happened over my career, the things that have just been amazing to see, I think back in 1987, I had heard about this wonderful new thing that they could do for heart attacks. It was a clot buster. It was going to save heart muscle. You would give it in the vein of somebody, and it would travel up to the clot that was in the artery in the heart, blocking that artery and causing the heart attack, and it could save somebody. My grandmother Ferris, had a heart attack in September of 1987. We were just on the cusp of being able to use that. She went to a hospital in Omaha. They weren't quite ready to push it out the door yet. She had a heart attack. They weren't able to use it. She did pretty well the first week, but then she died on the 7th day. And I just think back and I think about how we were just on the cusp of being able to use that. It wasn't more than 2 months later. I was in the ER, and one of my dear friends that I worked with there at Emmanuel, her dad had a heart attack, and he came in, and I was the first nurse to give that new drug, and I gave it to her dad. And I remember I kept saying, you got to just keep it together. You got to keep it together. I was so afraid of making a mistake. I wanted to make sure this was just perfect. And I gave her dad the medicine, and within just a few minutes we saw the effects of it, and he started to reperfuse his heart muscle, and his pain went away, and we could see evidence that we had made an impact on the EKG. I stayed very calm, and I stayed very collected, and I did my job. I got everything finished up for him. And then after we got him up to the intensive care unit, I went into our break room, and then I just kind of fell apart. It was just all very emotional, because I knew that there was something there that we did that really made a difference. And I remember I was on my break, and all I wanted to do was talk to my dad. So I called my dad, and I said, "Oh, Dad, I think I'm going to have to quit nursing." He said, "Well, why?" I said, "Well, I'm just a nervous wreck right now." And he said, "Well, why are you a nervous wreck?" I didn't go into detail, but I told him we'd done something really exciting. And I said, but I'm not sure that I should be a nurse. And he said, "Well, do you still care about your patients?" And I said, "Absolutely." He said, "Well, you should not quit until the day that you call me and tell me that you don't care. That's what you gauge this on." So I said, "Okay, I think I can do it." So went back out. The other thing that has happened during my career, which is wonderful too, is we always used to put so much emphasis on what we would do in the ER. Well, we got to thinking a little bit different. We thought outside the box, and we said, why can't we do some of these things in the field? About 2006 in this area of the country, we were not doing 12 lead EKGs in the field. We thought we had to do them in the ER. We said, wait a second, why can't we do them in the field and have it transmitted to the ER so that we know ahead of time if somebody's having a heart attack? So we started with Bennington, and we helped them to get it going. And then we went to Irvington, Ponca Hills, Fort Calhoun, and then pretty soon Omaha Fire wanted to do that also. And now all over this region, they're doing 12 lead EKGs in the field, including here in Blair. They transmit it to the hospital ahead of the patient. That way the ER staff can be ready and waiting and do something definitive for that patient who's having a heart attack. The other exciting thing that is coming along is the same thing that they've been able to do for the heart, they're now able to do for the brain, save brain tissue. So now, instead of just letting somebody have a stroke, now we can intervene early on. And we're teaching all of the EMS paramedics and EMTs how to recognize a stroke very quickly, how to screen for it, how to quantify it, how to call it in and be ready. And Dr. Johnny down at Emmanuel Medical Center is now going in, threading a catheter up in groin or wrist, threading it up into the brain, snatching the blood clot out, pulling it out, and having a return to neurological stability. And it's just phenomenal to see. So those kinds of things, and of course there have been many, many things that have transpired over the 48 years that I've been a nurse, but those are just a few of the things that have really touched my heart. And I'm just, each day I think, what can we do to make an impact and to improve health care? So I think that's probably.
All right. We've been listening to Linda Ferris Jensen, a good friend of mine actually from high school. We've retained our friendship over the years, and another story and what we hope will be one of many that we can bring to our viewers. Thank you very much, Linda.
Thank you.